Okay, so good dinner says, now present tayo sa different diagnostic procedure under your respiratory system and your cardiovascular system. But before anything else, proceed muna tayo sa mga different terminologies para sa ganun we can easily understand yung mga topics natin later on. So first, we have your biopsy. Pag sinabi nating biopsy, it is the removal of sample tissue. Okay, pag sinabi nating removal of sample tissue, kukuha sila, okay? Kukuha sila ng small amount ng tissue, for example, sa skin. Ano pa? Pwedeng sa lungs mo, pwedeng sa GI mo, para sa ganun, ma-rule out nila. Okay? To rule out para sa ganun, to rule out, okay, cancer. Okay, para makita nila kung may cancer ba yung patient. So, ibig sabihin, pag biopsy, it is a confirmatory test for your cancer. Second one, we have your synthesis or your synthesis. Okay, pag sinabi natin synthesis or synthesis, this is the aspiration of FAB. Sino yung FAB? Your fluid, air, and blood. Okay, it's your fluid, air, and blood. Anong mga example nito dito? Your amniocentesis, your thoracentesis, your paracentesis. That is the example of the different diagnostic tests that ends with synthesis. Next, we have your MET3. Pag sinabi nating MET3, it is the measurement. Okay, MET3 is measurement. At anong best example natin dito? Pag once na gusto, okay, we have your audiometry. Okay, your audiometry. Okay, si audiometry from the word audio, yung hearing. So, ang ginagamit natin dito na unit is decibels. Second one, we have your pelvimetry and your tonometry. When we say tonometry class, this one is the measurement for your intraocular pressure or your IOP. And the normal IOP natin is 20 or 10 to 21. Normal IOP, 10 to 21 mmHg. And then, fourth one, we have your gram. Your gram or graphy. At para saan to? It is a visualization of polyps, pagbukol daw, ulceration, tumor, and obstruction. Okay, so visualization of polyps, ulceration, tumor, and obstruction. Pag sinabi natin gram or graphy, this one ay indirect visualization. Bakit siya naging indirect visualization? Dahil we use your contrast dye. Gumagamit tayo ng contrast dye. Kaya siya naging indirect visualization. And lastly, we have your number 5. Okay. The number 5, we have your scopy. Okay? It's scopy. Sinabi natin scopy, ano si scopy natin. Your scopy is a direct visualization. Okay, direct visualization. Ang mga example natin dito, your bronchoscopy, your endoscopy. Okay? So, ito yung mga different diagnostic procedure natin. So, ito yung mga equipment. Okay? These are the equipments na ginagamit natin. For GI, gumagamit tayo ng endoscope. Pag respi, bronchoscope. And pag urinary system, gumagamit tayo ng cystoscope. Okay, that are the different materials or equipment na ginagamit natin for this diagnostic procedure. Okay, so now present tayo sa first natin. We have your arterial puncture for your ABG test. So pag sinabi natin arterial puncture for ABG test, dito ay kumukuha tayo ng blood. So ang specimen, okay, the specimen we use ay blood. Okay, saan tayo kumukuha? Sa artery. Kaya nga siya tinawag na arterial blood or arterial puncture. Okay, pag sinabi natin ABG class, yung ABG natin, these are your metabolic, respi, alka, acidosis, or uncompensated, compensated, fully compensated. That is the example of your ABG test or analysis. So, before natin gawin yan, before tayong mag-analyze dyan, kukuha muna tayo ng sample. Kukuha muna tayo ng sample sa artery. But before tayong kumuha ng sample, before kang mag-puncture ng artery, we should perform your Allen's test. Kailangan nating i-perform si Allen's test prior sa pag-puncture ng ating artery. At bakit? Ganito kasi si Allen's test class. Ito si Allen's test natin. Okay, that is your Allen's test. When I say Allen's test, the main purpose, okay, yung pinaka-purpose ng ating Allen's test is to check, okay, to check or assess collateral circulation. Okay, to check or assess collateral circulation. Paano si collateral circulation, class? Tingnan nyo yung diagram. Una, naka-close fist kayo. And then, tatakpan mo yung ulnar and the radial artery. And kapag natakpan mo yan, ask the patient to open his or her hands. At pag inopen niya yung hands niya, makikita mo na parang may changes. May pag-iiba doon sa kulay ng kamay ni patient mo. So, anong kulay niya? Magiging pale. Magiging pale yung kamay ni patient mo, class. Bakit? Kasi nga, tinakpan mo. Tinakpan mo si radial and your ulnar artery. Always remember that this artery carries oxygenated blood. So, kung tinakpan mo yung artery na yan, ibig sabihin, walang dugo na pupunta dito sa iyong kamay. Kaya magiging pale siya. At anong gagawin mo pag naging pale siya? Ngayon, una mong tatanggalin yung ulnar artery. So, ibig sabihin, yung thumb mo, nandoon lang siya sa radial artery. So, ngayon, pagtanggal mo ng thumb mo, ma-observe mo na babalik sa normal color yung kamay mo. At kapag once na bumalik yan sa normal color, ibig sabihin, maganda ang collateral circulation. Maganda ang collateral circulation. Paano kapag hindi siya bumalik? Ibig sabihin, hindi maganda ang collateral circulation. Bakit? May possibility na nagkaroon ng blockage. May possibility na nagkaroon ng narrowing. So kapag once na hindi maganda yung collateral circulation, anong gagawin natin? We should withdraw or discontinue the procedure. Bakit kailangang i-discontinue? Kasi nga class, this one is the artery. Pag sinabi nating artery, mataas ang pressure. So, increase ang pressure dyan. Bakit? Kasi galing yun sa puso. Remember, the puso exert pumping, exert pressure para ma-administer yung dugo all throughout ng body. Kaya nga mataas yung pressure sa artery natin. So ngayon, the most common site, okay? The most common site is the radial artery. Okay, ito, this is the radial artery. It is the most common site. Okay, yan yung most common site ng ating puncture. Diyan tayo kumukuha ng blood sample. Sir, bakit dinidiscontinue kapag once na hindi maganda yung collateral circulation? Kasi ganito yan, class. For example, dito sa iyong radial ay sa ulnar artery, may blockage. Ngayon class, dahil sa increase ang, so pag may blockage to, sa increase ang pressure, okay? Dahil increase ang pressure dito sa may radial artery natin, kapag pinuncture yan, may possibility na mag-rupture siya. So kapag nag-rupture yan, meron pa bang dugo na pupunta dito sa kamay mo? Wala na. Bakit? Kasi hindi nga maganda yung blood circulation sa ulnar artery mo, tapos nasira pa to. At kapag wala ng blood supply yan, magdi-decrease yung oxygen supply or the blood supply. At pag na-decrease yung oxygen supply, mamamatay yung tissue sa kamay mo, can cause necrosis. Mamamatay yung kamay mo. At pag nagkaroon ng necrosis, that can lead to amputation. That's why it is important prior sa procedure, we need to perform Allen's test. Okay? So, proceed tayo. If the patient receiving oxygen, make sure to delay. Okay? Kailangang i-delay mo muna for 15 minutes. Bakit? For accurate result. Okay? Para for accurate result. Kasi class, kapag ABG yan, ibig sabihin, chinecheck yung level of oxygen sa blood mo. So ngayon, kapag once na binigyan ka ng oxygen, tapos kumuha ka ulit agad-agad ng sample, pwede kang magkaroon ng inaccurate result. Possible na mataas yung oxygen saturation mo kahit hindi naman pala kasi kabibigay mo lang ng oxygen. And in case if your patient nag-a-undergo ng nebulization, nagna-nebulizer si patient mo, you should delay the procedure for 20 minutes for the better and accurate result. And aside from that, be sure to indicate laboratory results, sleep, and the amount and type of oxygen. So usually, ang ginagamit natin dito ay Venturi mask. It is your Venturi mask. Okay? So kapag kukuha tayo ng dugo dito sa ating artery, we don't need fasting. Okay? No fasting tayo sa ABG analysis or a puncture for arterial blood gas test. Hindi natin kailangan ng fasting. Bakit? Hindi naman sugar, hindi naman fats or cholesterol ang chinecheck dito. Ang chinecheck dito, it's the level of oxygen in the blood. That's why we don't need fasting anymore. So yan si Allen's test natin. Okay? Next, we have your sputum examination. When I say sputum examination, we have different types of sputum examination. So first, we have your gross appearance of the sputum. From the word itself, maalalaman nyo na kung ano yung mga possible na pwede nating or ano yung purpose nitong diagnostic test na ito. First, we have your gross appearance. When I say appearance, from the word appearance, titignan natin yung kulay niya. Ano pa? Yung characteristic ng kanyang sputum. So, kaya siya tinawag na gross appearance. So, first, we need to collect early in the morning. So best time to collect the specimen, it's early in the morning. Okay, it's early in the morning tayo kukuha ng sample. Sir, paano kapag sa examination may question, what is the best time to collect sputum specimen? Letter A, early in the morning. Letter B, 6 a.m. Letter D, upon awakening. Letter C, upon awakening. Letter D, 8 a.m. So we have up so we have early morning, 6 a.m. Upon awakening, 8 a.m. Best time, it's upon awakening. We should get specimen upon awakening. Okay, that is the best time. Pero pag wala siya upon awakening, we can choose early in the morning. So, we should collect early in the morning and use sterile container. When I say sterile container, kailangan natin siyang lagyan ng 15 ml of sputum. Ganyan kadami yung kailangan natin. Okay? So, aside from that, pag meron ka na, rinse the mouth with plain water before and after. Okay, so rinse the mouth with plain water before the collection of this specimen. Bakit kailangan nating i-rinse? Diba sabi ko, upon awakening. So class, may possibility pagkagising mo, there is a microorganism present in your saliva or mouth. So para hindi tayo magkaroon ng false positive result, tell to your client or to your patient na dapat mag-perform siya ng what they call this one, ng mouth or gargling. Kailangan niya magmumog. Kailangan niyang i-rinse yung kanyang bunganga gamit ang water. Baka may question, Sir, bakit hindi pwede ang what they call this one? Bakit hindi pwede ang mouthwash? Hindi ba pwede ang toothbrush? Hindi pwede. Hindi pwedeng mag-perform ng mouthwash and toothbrushing pagkukuha ng specimen. Why? Because your toothpaste and your mouthwash has a content of alcohol. May content siya na alcohol. So, kapag once na nag-toothbrush ka, once na nag-mouthwash ka, tapos nilabas mo yung sputum mo, yung ating content na alcohol sa mouthwash and toothpaste mo, pwede siyang humalo sa sputum. At pag humalo yan sa sputum, anong possible na mangyari? Mamatay yung microorganism that can be pwedeng magkaroon tayo ng result na false negative result. Meron ka sanang sakit, kaso dahil namatay yung microorganism, hindi na siya ngayon na detect. Kaya that's why before, rinse it with water. Then after mo, kailangan mo ding i-rinse ng water. Bakit? Para matanggal yung unpleasant taste. To remove the unpleasant taste for hygiene purposes. And then instruct the patient to hack off. So, yun yung gagamitin natin. Hack up. Okay? Hindi pwedeng spit out. No spit out. Yes for expectorate. And pwede din yung cough out. So, bakit hindi gagamitin si spit out? Kasi si spit out, laway ang laman yan. Ang kailangan natin dito is sputum. Okay? So, yan yung ating gross appearance. And then, send the specimen immediately. So, kailangan within 30 minutes, ma-submit mo na sa laboratory. Kasi kapag more than 30 minutes yan, we should discard the specimen. Why? Because the specimen is already expired or contaminated. Okay? So again, yan si gross appearance of sputum. So usually may mga kulay tayo. Kapag yung kulay ng what they call this one, kapag yung kulay ng sputum ng patient mo ay kulay yellow, pwedeng indication yan ng acute bronchitis. Pwede din kulay yellow-green. Kulay yellow-green yan, we have your PTB or pulmonary tuberculosis. And lastly, we have your rusty sputum. So rusty sputum, pathognomonic sign for pneumonia. Okay, so yan yung mga different color na pwede natin makita kay patient. Okay, so next natin we have your sputum culture and sensitivity test. Class, I forget, kapag before collecting pala ng specimen, kailangan natin mag-deep breathing exercise. So instruct the patient to inhale deeply, i-inhale siya ng malalim, and then i-exhale niya yan na gamit ang bunganga. So dapat naka-pursed lip siya kapag i-exhale niya. And the third time na gagawin niya yung inhale and exhale natin, sa last time, mag-i-inhale siya ng malalim, and then kailangan niyang i-cough out or i-expectorate or i-hack up. Okay? Kailangan niyang gawin yun para sa ganun, okay? Para sa ganun, mas maganda yung sample natin. Kasi ang gustong makuha na sample mo is sputum, yung galing sa lungs mo. Okay, yan yung reason kung bakit kailangan mag-deep breathing exercise. Next natin, we have your sputum culture and your sensitivity test. When I say sputum culture and sensitivity test, gumagamit tayo ng sterile container. But this time, hindi na 15 ml ang kailangan natin. Kailangan na natin ng 3 to 5 ml sample. 3 to 5 ml sample. Okay? So, ganun lang din yung process, class. Kailangan pang magko-collect tayo ng sputum, kailangan before and after, rinse it with water. Same lang, magde-deep breathing exercise tayo, and then collect the specimen before the first dose of antibiotic. Okay? Bakit kaya, di ba? Class, pag sinabi kasi natin sputum culture and sensitivity test, from the word culture, this one is the etiology. Okay, ano yung etiology? Ano ba yung microorganism? Ano ba yung gram ng bacteria? It is a gram positive or gram negative bacteria. So, yun yung mga kailangan natin or yan yung gustong tignan ng culture. How about your sensitivity? So, pag sinabi natin sensitivity, what antibiotic will take effect? Okay. What antibiotic will take effect? Okay, ano daw yung antibiotic na magta-take effect kay patient? Ano daw yung antibiotic na papatay doon sa microorganism? Ano daw yung antibiotic na magpapababa sa number ng microorganism sa katawan ni patient? That is your culture and sensitivity test. Pag culture, etiology. What is that microorganism? Gram positive ba siya or gram negative siya? Pag once naman na sinabi nating sensitivity, ano ba yung makakapatay doon sa bacteria? Ano ba yung makakahina sa production ng population ng bacteria? That is the culture and sensitivity test. Usually, binibigay natin or ginagawa natin si sputum culture and sensitivity test kapag yung pasyente natin ay magre-receive ng antibiotic. So, before mong ibigay yung first dose ng antibiotic, make sure na nakapag-sputum or culture and sensitivity test si patient. Bakit? Para alam natin kung anong tamang gamot ang ibibigay sa pasyente mo. Sir, paano yun? Ilang buwan, ilang days ba bago lumabas yung result ng sputum culture? Ito ay usually umaabot ng 2 weeks. Sir, paano yan? Diba 2 weeks siya? So, ibig sabihin, kailangan muna nating hintahin yung result? No. hindi na natin kailangan hintayin yung result. Sir, paano natin malalaman kung magte-take effect ba yung gamot? Class, always remember, kaya natin ginagawa yan to check if gram-positive or gram-negative ba yung bacteria. Kapag once na yung patient, okay, mag-receive ng first dose, yung sinasabi nating first dose, that is the broad spectrum. Pag sinabi natin that is the broad spectrum, okay, it's broad spectrum antibiotic. Okay, pag sinabi kong broad spectrum antibiotic, it can kills, okay, it can kill the gram positive and negative bacteria. So, ipapatahin niya yung gram-positive and gram-negative bacteria. That's why we give the broad-spectrum antibiotic before or after mag-perform or after mag-collect the patient ng sputum. So ngayon class, whether it is gram-positive yung patient or gram-negative man yan, kaya siyang patahin nitong broad-spectrum antibiotic natin. Okay, that is your sputum culture and your sensitivity test. And lastly, we have your direct sputum smear microscopy. When I say direct sputum smear microscopy, i-assess niya daw the presence of active pulmonary tuberculosis. Therefore, your DSSM is the confirmatory test. Okay, it is a confirmatory test for tuberculosis. Yan lang, wala nang iba. Hindi confirmatory test si PPD or yung skin test ninyo. Hindi confirmatory test si X-ray. Only your DSSM or your direct sputum smear microscopy. Same lang yung procedure class. Kailangan magbigay ng sputum early in the morning, the best time. Deep breathing exercise prior sa pagkuha ng specimen. But ang pinagkaiba nila dito sa ating DSSM, we get, okay, kumukuha tayo ng sample for 3 consecutive days. Okay, 3 consecutive days. So, yan yung kinukuha natin na sample. So, question. So, kung 3 consecutive yan, first day, second day, third day, so 3 araw tayo kukuha. Sir, sabi mo, best time is early in the morning. Oh, what if your patient, si patient mo pumunta ng RHU dahil meron siyang nararamdaman na early afternoon fever, and then meron din siyang nararamdaman na what they call this one, na unexplained weight loss. Okay, nagkakaroon siya ng weight loss. So ngayon pumunta siya sa RHU. Pagpunta niya sa RHU, 1 p.m. na. Sabi ni Doc, kailangan niya mag-undergo ng DSSM. So ngayon, pumunta siya ngayon. So anong gagawin mo as a nurse? Kukuha ba tayo ng sample or sasabihin mo sa kanya, patient, ma'am, sir, balik ka na lang po by tomorrow early in the morning, kasi yun po yung best time namin sa pag-collect ng sample. So ang gagawin mo as a nurse, kumuha ka ng sample. Sir, bakit sabi mo early in the morning? Yes, that is the best time. Pero early in the morning, kapag once na first yan, kahit kumuha ka anytime, pwede lang kumuha anytime. Bakit? Yan ay tinatawag nating spot collection. That is the spot collection. How about kapag second day, sir? Pwede pa bang anytime? No. It should be early in the morning hanggang sa pangatlong araw. Dapat early in the morning. So, kailangan makakuha tayo ng 2 positive result. So, dito sa tatlong ito, kailangan mo makakuha ng 2 positive result para masabi na meron kang pulmonary tuberculosis. Okay, that is the direct sputum smear microscopy. Next natin, we have your cytologic sputum examination. When I say cytologic sputum examination, ito yung ina-assess niya yung presence of abnormal or cancer cell. So therefore, the cytologic sputum exam, niro-rule out niya yung cancer or lung cancer. It is a diagnostic test or confirmatory test for lung cancer. So, collect sputum in 3 consecutive days. Same lang sila, class. Same lang nakukuha tayo ng sputum for 3 consecutive days. Okay, usually, kumuha tayo ng sample before breakfast. Okay, so dito naman class, sa cytologic natin, kailangan natin ng 5 to 10 ml ng sputum. Okay, it's 5 to 10 ml of sputum. So class, I forgot na mention dito, na-mention ko kanina dito, your gram-positive and gram-negative bacteria. Pag sinabi kong gram-positive and gram-negative bacteria, pag gram-positive yan, class, okay, pag gram-positive class, usually ang kulay niya yan ay blue or purple. Sorry, blue or purple. Pag yan naman ay gram-negative, ito ay pink or red. Yan yung kulay nila sa microscope. Ito yung best example ng blue natin. Okay, ito, that is your gram-positive bacteria. Okay, that is the gram-positive bacteria. Anong usually example ng gram-positive natin? Your gram-positive ay, example dito, your PTB. How about sa gram-negative? Your gram-negative is one yung sa may Neisseria, gonorrhea. Yan yung example niya. And then your Diplococcus. Ito yung mga example natin na gram-negative bacteria. Your Neisseria, gonorrhea that can cause your tulo, and then your Diplococcus. Okay, so we're done with your sputum examination. Now, proceed tayo sa bronchography natin. Okay, sa bronchography natin, we used Bridge blank or your contrast dye. Gumagamit tayo ng contrast dye sa ating bronchography. Okay, so unang-una sa lahat, okay, okay, so a radioplank is instilled directly into the trachea and bronchi through bronchoscope, and the entire bronchi tree or selected areas may be visualized through X-ray. So again, gumagamit tayo ng contrast dye. Okay. We use your contrast dye. Okay, pag gumagamit tayo ng contrast dye, pag sinabi natin bronchography, this one is indirect. Okay, that is indirect visualization. So, anong ginagawa natin kapag indirect visualization? So, gumagamit tayo ng contrast dye. And kailangan, pag indirect visualization yan or bronchography, that is an invasive procedure. So, pag sinabi natin invasive procedure, kailangan kapag invasive procedure yan, we should need to secure consent. Kailangan nating mag-secure ng consent. So, question, sino magsasecure ng consent? Sino mag-obtain ng consent? Tayo or the physician? Dapat the physician. Si physician ang mag-obtain ng consent dahil tayo ang ating role lang during signing of consent, it's witness. Aside from witness, we are patient's advocate. So pag sinabing patient advocate, dapat nasa panig ka ni patient. Dapat pinoprotektahan mo siya if may maling decision si doctor. That is your patient's advocate. So, check for allergies to seafood or iodine. So, bakit kailangan i-check yung allergic sa seafood or sa iodine? Because this contrast dye is made up of iodine. Okay, so para ma-assess mo if yung patient mo may allergic sa iodine, kailangan i-ask mo siya kung meron siyang allergic sa seafood, sa mga pagkain na nakukuha sa dagat. Okay, that is the iodine. So, kailangan i-assess mo kung meron ba siyang allergic sa seafood. What if may allergic sa seafood? Anong gagawin mo? Pag meron siyang, what do you call this one? Pag meron siyang allergic sa seafood, we should notify the physician and discontinue. Okay? Discontinue the procedure. Bakit? Huwag gagawin. Because can cause anaphylactic reaction. Okay? Magkakaroon ng allergic reaction. At yung anaphylactic reaction na yan, pwedeng mamatay si patient. Bakit? Isa sa mga dahilan or isa sa mga manifestation ng ating allergic reaction is difficulty of breathing because of the response of the body or the inflammatory response of the body. Okay? So, yan yung mga kailangan natin i-assess, i-check for the allergies in iodine. And then aside from that, we should put the patient to NPO 6 to 8 hours. Okay, dapat naka NPO lang si patient 6 to 8 hours before the procedure. Bakit? Okay, para mas maganda yung visualization and to prevent aspiration. Okay, para ma-prevent natin yung aspiration. And aside from that, kailangan naka-NPO pa rin siya until gag reflex return. Okay, pag bumalik na yung gag reflex, pwede mo na siyang painumin, pwede mo na siyang pakainin. Hanggang hindi pa bumabalik, dapat wala pa rin siyang isusubo. Wala siyang iinumin, wala siyang kakain. Bakit? To prevent aspiration. Okay? Para ma-prevent lang natin din yung aspiration. So, yan si ating contrast dye. Usually, class, kapag magbo-bronchography ka, okay, pag magbo-bronchography ka, kailangan check natin yun. Class, prior pala sa procedure. Prior sa procedure, kailangan mong i-assess yung iodine, di ba? Assess for allergy in seafood. Second one, kailangan mong i-check yung vital sign. Okay, check the vital sign. Third one, okay, kailangan yung site natin. Saan ba natin ipapasok or i-introduce yung iodine? We have your brachial or the femoral. Okay, si femoral is the most common site. Okay, and then kailangan check din natin. Okay, check natin yung blood test and creatinine clearance. Okay, bakit kailangan i-check yung creatinine clearance? Dahil the dye is nephrotoxic. Okay, the dye is nephrotoxic. Post naman natin, post-procedure. Ano yung mga nursing responsibility natin? First, kailangan bleeding. Monitor for bleeding. Okay, kailangan natin monitor yung bleeding and then check the vital sign. Okay? So, paano natin mamamonitor yung bleeding? Kailangan mo magbigay ng R ng para ma-monitor natin yung bleeding class or ma-eliminate natin, ma-lessen natin yung bleeding, kailangan tayo mag-apply ng pressure. Okay, apply pressure. Okay. So, usually, sandbags yung ginagamit natin. Okay? Sandbags. And then, kailangan nating i-eliminate. Okay? Dye elimination. Okay, kailangan nating eliminate yung dye. So, pag dye elimination yan, class, usually, paano? First, kailangan high fiber diet. Second one, increase oral fluid intake. Third, administer IVF as ordered. And then fourth, administer laxatives as ordered. So yan yung mga kailangan natin gawin post-procedure. Okay? So yan. As ordered. So we're done with our bronchography. Proceed tayo sa bronchoscopy natin. Okay, sa bronchoscopy natin, it is your direct visualization. When I say direct visualization of the larynx, trachea, bronchi through a flexible fiber. Okay, through a flexible fiber. So ngayon class, kung direct visualization yan, this one is also a invasive. Okay, invasive procedure yan. So kapag invasive procedure yan, kailangan natin ng consent. Okay, aside from that, kailangan si patient NPO 6 to 12 hours prior sa procedure. So kapag NPO siya, bakit? To prevent aspiration. And then, kailangan din natin i-check yung coagulation studies. We need to check the coagulation studies. Bakit? Bakit kailangan i-check yung coagulation studies? Pag sinabi natin coagulation studies, this is the bleeding time. Okay? The clotting time. Okay? That is the bleeding time or the clotting time. Bakit kailangan i-check yan, sir? Anong correlation niya? Tignan mo, class. May ipapasok na flexible fiber. That flexible fiber can cause injury or damage sa mucosal lining mo. Pag once na nagkaroon ng injury or damage, that can lead to bleeding. So kapag once na matagal yung clotting time mo, that can lead to excessive blood loss, and then pag may excessive blood loss, can lead to hypovolemic shock hanggang mapunta sa death. Kaya kailangan check yung coagulation studies. Usually, ginagamit natin yung prothrombin time. And the prothrombin time, usually, ang normal niya, okay, normal, it's 10 to 13 seconds. Kapag yan ay more than 18 seconds, that is already prolonged. So, kung prolonged na yan, don't continue the procedure. So, we need to stop the procedure kasi si patient at risk for bleeding. And then, remove dentures or eyeglasses. Bakit kailangan i-remove yung dentures? To prevent aspiration. How about yung eyeglasses, sir? Si eyeglasses naman, di ba gagamit tayo ng flexible fibers? Pwedeng matamaan ni doc yan. Pag natamaan niya yan, may possibility na mabasag. Kaya kailangan remove dentures and eyeglasses. And next, we need to sedate the patient. Okay? We need to sedate the patient. Okay? Paano natin masasedate si patient? By giving Valium or sedatives. Okay? So, kailangan natin siya bigyan ng sedatives. Okay? Sedatives. Such as volume. Okay, gagamit tayo ng volume. So, aside from that, okay, bakit kasi sedate si patient? Papatulugin daw si patient para hindi siya maging anxious. Para hindi maging anxious yung client mo or yung patient mo. Kasi kapag naging anxious yan, class, it can cause further complication. Okay? So, kailangan, di ba, tayo pa lang nga, di ba? Ikaw, imagine mo, makikita mo na ipapasok sa iyo yung malaking flexible fiber. Hindi ka ba matatakot? Di ba? Ako nga, 7 inches takot na. How much more yan? Napakahaba. Kaya kailangan i-sedate si patient to prevent anxiety. Okay? Aside from that, we also give your lidocaine spray to suppress the gag reflex. Bakit kailangan i-suppress yung gag reflex, class? Diba? Ang target natin, it's the lungs, not the GI. So, para sa ganun makapasok yung flexible fibers natin, kailangan ibigyan mo ang lidocaine spray para mawala yung gag reflex. And then lastly, we also give your atropine. So, ito yung mga medication. Okay, yung mga meds na binibigay natin. First, we have your Valium or sedatives. Second one, we have your atropine sulfate. And lastly, your lidocaine. Para saan si atropine sulfate? It decreases the secretion. So, diba, imagine may pinapasok sa yung tubo, tapos naglalaway ka. That laway pwede siyang pumunta sa lungs mo. That can lead to aspiration. So, yan yung mga kailangan natin medication ibigay prior sa procedure, and make sure resuscitation equipment should be available in the bedside in case of emergency. Okay? In case of emergency. Wait lang. Okay, class. Aside from Valium, class, we also give, pwede ding diazepam. Okay, diazepam ang ginagamit natin. So, yan yung mga gamot na ibibigay natin prior sa procedure. How about your post-procedure? Ito pala si bronchoscope, class. Ayan. Yan yung ipapasok kay patient mo. Okay? Okay, post-procedure, check the vital signs. Okay, check the vital signs. Bakit? Diba? May pinasok sa bunganga mo, class. So, may possibility na yung patient mo or the vagus nerve, okay, pwedeng ma-stimulate yan. It decreases the heart rate. Decrease na yung heart rate. Kaya monitor the vital signs, especially the blood pressure, heart rate, and your RR. So, bakit RR? It's for baka may respiratory distress. Okay? Position, high Fowler's position. And then make sure to check the gag reflex. Okay, before ka for example, nag-complain si patient, class. Nag-complain si patient na gusto niya nang uminom, gusto niya nang kumain, gutom na siya, uhaw na siya. Make sure mo na i-check mo muna yung gag reflex ni patient. Kasi kapag hindi mo chinek yung gag reflex ni patient, tapos wala pa pala, ngayon binigyan mo ng food, pwede siyang ma-aspirate. Kaya always na i-check mo na yung gag reflex pag naghihingi si patient ng makakain. So, class, pag wala pang gag reflex, huwag magbibigay. Pag may gag reflex, pwede ka nang magbigay. So, anong gagamitin natin to check the gag reflex? The tongue depressor. Okay? Tongue depressor. So, NPO until gag reflex return, monitor for bloody sputum. So, pag may bloody sputum, it is an indication na may damage, may injury, may perforation. Okay? And then monitor for respiration. Baka kasi may respiratory distress si patient. And if in case of complication, you should notify the the physician right away. Monitor the physician right away. Okay? That is your bronchoscopy. So class, I forgot lang to include here in our bronchography the different medication we use. Okay? I forgot lang to give. So, may mga medications din tayo. Diba sabi ko, isa sa mga complications or pwedeng mangyari kay patient kapag nag-undergo ng bronchography ay yung anaphylactic reaction. So, kapag may anaphylactic reaction class, kailangan, anaphylactic anaphylactic reaction, kailangan yung meds natin, una, magbigay ka ng epinephrine. Okay, bakit epinephrine class? The epinephrine has a bronchodilator effect. Okay, bronchodilator siya pero vasoconstriction. Okay. So, bronchodilator, bronchoconstriction. Sabi ko may difficulty of breathing because of bronchoconstriction. So, ibigay ka ng epinephrine para mag-dilate yung kanyang bronchus. Aside from that, so, number 2 medication natin, we have yung tinatawag natin na diphenhydramine. Okay, nagbibigay tayo ng diphenhydramine. Bakit? Your diphenhydramine is antihistamine to stop the histamine release. Always remember that histamine, siya yung dahilan kung bakit nagkakaroon ng inflammatory response. Pag may inflammatory response, nagkakaroon ng narrowing. Pag may narrowing, karoon ng difficulty of breathing. Kaya kailangan magbigay tayo ng diphenhydramine to stop the release of histamine, to stop the inflammation. Aside from that, nagbibigay din tayo ng Benadryl. Okay, i-sedate natin pag Benadryl yan class, side effect, side effect ng Benadryl natin ay sedation. Okay, pag sedation yan, priority mo, safety. Okay, safety ang priority mo. Okay, so, last natin, we have your methylprednisolone. Your methylprednisolone. So, yan yung binibigay natin. It is a fast-acting steroid. It is an anti-inflammatory action. Kaya binibigay natin yan para ma-prevent or mawala yung inflammation kapag may allergic reaction. And aside from that class, sabi ko, kailangan ma-eliminate yung dye. So, by increasing the fiber diet, by administering laxative, by increasing OFI, and then by administering IVF. What sabi ko? So, kailangan natin siyang eliminate. Bakit? Nephrotoxic siya. So, kung nephrotoxic yan, paano kapag sinabi ng patient mo, Ma'am, sir, nag-complain siya sa'yo after ng procedure. Ma'am, sir, yung ihi at tae ko po ay kulay puti. Anong gagawin mo? Notify the physician or ignore? Okay, you should ignore it. Bakit? That's a normal finding. Ibig sabihin na eliminate mo yung dye. And that is a positive outcome. Wala kang dapat ikabahala kasi dapat naman talaga na eliminate natin yung dye. Okay? Next natin, we have your thoracentesis. Okay, pag sinabi kong thoracentesis, it is the aspiration of fluid in the pleural space. Diba sabi ko, we have your fluid, air, and blood. Okay, so yan yung mga ginagawa natin. Okay, so pag once Pag thoracentesis pala class, pag hindi nyo nakita si thoracentesis, tinatawag din siya na pleural top. Okay. Baka yan ang gamitin na terminology sa exam. That is your thoracentesis. Okay, so kapag once na may thoracentesis class, kailangan it is also an invasive procedure. Invasive din siya. Okay, invasive procedure. So kapag invasive procedure, kailangan natin ng consent. We need to secure consent. And then, check the vital signs. Okay, check the vital signs. And then yung position natin, upright, leaning on overbed table. Okay, kailangan upright. Bakit? For lung expansion. Okay, for lung expansion. And then, you should instruct the patient to avoid coughing during the insertion to prevent pleural perforation. So, avoid coughing. Ano pa? Sneezing, yawning, moving, and talking. Okay, wag kang gumalaw or magsalita during the procedure para ma-prevent natin yung accidental puncture of lungs. Okay, para ma-prevent natin yung accidental puncture ng lungs. So, yan yung gagawin natin. And aside from that, turn the patient to unaffected side. So, kung yung right lung mo ang may problema, doon nagkaroon ng aspiration, kailangan i-position mo siya after. Anong gagawin natin? Dapat sa right. Okay? Sa right, para hindi mag-leak yung pleural fluid sa may thoracic cavity. Okay? And then, check for expectoration of blood. If the patient nagkaroon ng blood tinge. Okay, pag sinabi natin blood tinge, konti lang yung laman or yung dugo sa may laway or sa sputum ng patient mo, that's normal. Pero kapag bloody na yung kanyang sputum, that's already abnormal. It is an indication na may trauma na nangyari. Okay? So, ang priority natin dito sa thoracentesis, okay, ang priority natin dito is to prevent trauma. Priority to prevent trauma. Kaya, paano natin ma-prevent yung trauma? By instructing the patient na bawal mag-cough, bawal mag-sneeze, bawal mag-yawning, bawal mag-moving, at bawal magsalita. Okay? And aside from that, diba? Anong tawag natin kapag air ang laman? Okay, pag air ang laman class, okay, pag air ang laman ng lungs mo, okay, or ng thoracic cavity mo, it is pneumothorax. Kapag naman fluid, anong tawag natin? It's pleural effusion. Pag blood, it's hemathorax. Ano kapag pus? It's emphyema. Emphyema. Okay? So, yan yung mga different na pwede nating tanggalin. For air, fluid, blood, minsan may pus or nana. It's emphyema. So, usually class, kapag ito ay pneumothorax, ang insertion ng needle ay nasa second and third intercostal space. So, intercostal space dun sa may rib cage mo. Diba? Sa may rib cage. Wala ba dito? Ayan. So, dito portion sa taas lang yan, class. Sa taas lang yan. Kapag second and third intercostal space. Dito sa portion na ito. Diyan. So, kapag once naman na pleural effusion and emphyema, usually, it's 8th to 9th intercostal space. So, nasa baba. Bakit nasa baba, class? Mas mabigat ang fluid kaysa sa hangin. Kaya yung fluid sa baba, yung hangin nasa taas. So kapag hangin ang itatanggalin, agad second or third intercostal space. So post-procedure natin, okay, post-procedure, anong gagawin natin? First, position the patient in unaffected side. Position unaffected side. It's unaffected side. Second one, after positioning, apply sterile dressing. Okay, nag-apply tayo ng sterile dressing. Usually, yun yung Vaselinize. Vaselinize ang ginagamit natin. Pag sinabi natin Vaselinize gauze, yaan para ma-prevent yung leakage. Kaya Vaselinize gauze ang ginagamit natin. And then, check the vital signs, especially class RR. Kailangan RR ang natin to prove para makita natin kung merong si patient, tawag lang ito, merong respiratory distress. And lastly, kailangan natin i-promote, okay, promote lung expansion. Okay, we need to promote lung expansion. How? By deep breathing exercise. Paano? Okay, by deep breathing exercise. Ano pa? Aside from DBE, pwede din yung tinatawag natin na incentive spirometer. Okay, gumagamit tayo ng incentive spirometer. So, yan yung nag-i-inhale tayo through mouth na merong bola. So, yan yung mga ginagawa natin post-procedure. Okay, so yan. Okay. Okay, next we have your lung biopsy. Sa lung biopsy natin, anong ginagawa natin? To confirm cancer. Okay, to confirm cancer. This is an invasive procedure. Basta kapag may pinapasok na needle, invasive procedure yung class. So, kaya kailangan natin i-secure ang consent. So, we need to check the coagulation studies. Usually, your proton beam time, sabi natin anong normal, 10 to 13 seconds. Meron pa, yung PTT natin class, your PTT. Okay? Your PTT is your partial thrombin time. So, anong ginagamit natin dyan? Okay, si PTT natin, usually, ang normal niya yan, it's 20 to 39 seconds. It's 20 to 39 seconds. So, check the coagulation. Have vitamin K para to prevent bleeding. To prevent bleeding. Gumagamit tayo sterile technique. Bakit? To prevent infection. Para walang infection si patient. Okay? So, local anesthetic required. Okay? So, gumagamit tayo ng anesthetic. Usually, gumagamit tayo ng 2%. Okay? 2% infiltrate or para painless yung procedure. And then, pressure dressing upon insertion and aspiration. Okay? And then, administer analgesics and sedative. Usually, ano binibigay natin analgesic? We have your Demerol. Ano pa? Okay, Demerol. Ano pa? Nubain. And then your Valium. Okay, your Demerol is a narcotic. Okay? So, yan yung ginagamit natin. Okay? Mercenary cold, liquid demerol, the vein, and volume. Okay? So, yan. Aside from that, post-procedure, okay? Pressure dressing to prevent bleeding. Ano pa? Monitor for bleeding. So, kapag once na may active, paano natin masasabi kapag may active bleeding? Kapag active bleeding class, ibig sabihin, bright red. Okay? It's bright red. With large clot. Okay? With large clot pockets. With large, that it's an active bleeding. So, yan yung indication na may active bleeding. Monitor for respiratory distress and then complication. So, prepare for chest x-ray. So, usually, we should elevate the head of the patient, provide oxygen, and notify the BMD. So, kapag may complication class, ang gagawin natin, elevate, okay? Elevate the head of the bed. Ano pa? And then, provide O2. And lastly, notify MD. Okay? So, yan yung ginagawa natin. So, aside from that class, I forgot to mention, aside from, meron din yun dito. Bronchoscopy. Ayan. So, meron dyan class yung VS. Okay? So, ano yung VS natin? Your post-procedure. Okay? Your post-procedure, anong kailangan natin i-check? Yung BP ni patient. Bakit? Pag mababa yung PP, ibig sabihin, pwedeng merong hypovolemic shock because of bleeding. Because of heavy or excessive bleeding. Next, heart rate. Kailangan i-check yung heart rate. Bakit? Because of the stimulation of the vagus nerve. Next, RR. Bakit? Respiratory distress. And then the body temperature. Kailangan din i-check yung body temperature. Bakit? Pag 1 to 2 days yan class na, okay, 1 to 2 days post-procedure. 1 to 2 days indication may injury. Paano naman kapag more than 2 days? Okay? More than 2 days, anong indication niya? Kapag more than 2 days, merong infection. Okay? So, yan lang naman yung ating discussion regarding the, what they call this one? Regarding sa ating, the different diagnostic procedure for your respiratory system.